Replace Obamacare. Let me bring in right now Republican Congressman Phil Rowe. He's the chairman of the GOP Doctors Caucus. He also played a very instrumental role in drafting this bill. Congressman, thanks so much for the time.
Okay, thanks for having me on.
Take me inside the room this morning when you all got together. What was the message from Paul Ryan today?
Well, the message was upbeat. Look, it's been a long struggle, and a lot of times the debate is good. I think we've had a healthy debate in our party. That was good. I think it was good for the country. And most importantly for me as a doctor, it's important for patients, because I think about this every time we pass legislation. How does this affect our patients that I see? Does it make it easier for them and less expensive for them to come see the doctor and get their care?
Congressman, here is what Democrats, though, are saying today. This is no news to you. You've heard it as well. They say what's going on today is hypocrisy, that Republicans slammed the Democrats for jamming Obamacare through years ago without folks knowing what was in it. I mean, Paul Ryan was one of those folks slamming Democrats. Just listen to this.
I don't think we should pass bills that we haven't read, that we don't know what they cost. And if you rush this thing through before anybody even knows what it is, that's not good democracy. That's not doing our work for our constituents. We shouldn't rush this thing through just to rush it through for some artificial deadline. Let's get this thing done right.
So that was from 2009. No CBO score, no committee hearings on this. It's not the same thing.
That's very simple. That was a 2,500-page bill. Our bill is less than 200 pages long. There was a 27-hour debate in Energy and Commerce, and about a 20-hour debate in Ways and Means on the meats and bones of this. The Upton Amendment is 2 pages long. I read it in 3 minutes this morning, basically very specific. So everyone's had a chance to read this bill. We've been talking about these ideas and concepts now for years.
You don't think this is rushed through?
No, it's not rushed. I think most of us wish it had been done 2 months ago, but I do think the amendments that have been done are better. Look, I have a state that I live in right now, and the district that I represent, that a third of the counties have no way to buy insurance through the exchange. I have to do something. And I believe that this bill right here will do several things. One, I think it will increase the number of people with health insurance. I think it will lower the cost and increase the quality of care, and that's what I'm interested in.
Well, here's the thing, exactly to that point, Congressman, is the CBO score, for all of its benefits and faults and what people think about CBO, that helps kind of back you up and helps understand how many people it's going to help and what the effect of legislation is. Why not wait for a CBO score?
Well, I think the reason we're moving on is it's time to get past this debate. Look, the CBO scored the ACA in 2010. They said that 24 million people would be covered in the individual market. That number was about 10 million, and it's going down, not up. The CBO assumed that 14 million people would lose their insurance. That includes me. I've never had a mandate in my life to buy insurance, and I've always provided it for my family.
But, Congressman, do you think if you had waited for this CBO score on this, if you'd waited a week for a CBO score, you would have lost votes or something?
No, I don't think so. I think not. I think the votes are there, and I think it's a close vote, but I really believe the votes are there. And this is, again, this is not about politics and votes. This is about providing health insurance so that families can go out and get health care. In my own hometown, where I practiced medicine for over 30 years, 60 to 70% of the uncollectible debt in our hospital now are people with insurance. That's not sustainable. We had a 60% increase in premiums in our state in the individual market. That's not sustainable. They look at me and say, Dr. Rowe, please do something to help us with this.
Congressman,
so that's what we're trying to do.
I'm only having to cut you off to get over to the White House. We're going to go to President Trump. Can I just say real quick, Congressman, I wanted to wish you very good luck. You're getting married this weekend. So I want to say congratulations to you and best wishes to the bride. Just want to say that. Thank you so much for your time. Let's get over to the White House.